Please feel free to put any questions in the chat. I'll blend them in or come to them when I make my way back around. So just to expand a little bit on what I do at the fund, as Director of Client Services, I supervise the helpline. I started as a phone counselor when I was a student for social work, and now I do this job. So I live in Philadelphia. I'm from Bucks County and come to this work with experience growing up in poverty and just seeing how hard it is for single moms to make their way through. And so now I talk to pretty much all single moms all day on our helpline. So we are one of the largest and oldest abortion funds in the country. There's about nearly 100. There was 92 as of last fall. And we're part of a network of abortion funds. Almost everywhere you go, they're going to have at least one. And we're also about 38 years old. We came about after the Hyde Amendment was first passed and Pennsylvania opted out. They fought and opted out of using our own state dollars to pay for abortions for folks affected by Hyde, which is primarily people who get their insurance through Medicaid. So when Pennsylvania denied abortion coverage for its citizens, the fund was started, and no one at that time ever thought we would still have to exist now. It was like a mutual aid project, realizing how atrocious the Hyde Amendment was and thinking we've got to quickly fix this problem while assuredly we're going to get rid of Hyde, and it's still here. So we've grown over time. And really, when we think about the Hyde Amendment as a daily part of our work, it's undermining the actual intention of Medicaid to serve folks getting health care who may be low income, who are often facing challenges just making it day by day, and are being denied that coverage. We also on the helpline are talking to people who are uninsured, people who have private insurance that doesn't cover their care, or sometimes people who, because of security concerns, might not be able to use their insurance, even if it would cover it, because they're worried about other people in their household finding out, things like that. So people call in. Every fund looks different because you have to really grow to fill out the environment you're in. So it is not serendipitous at all that the fund in Philadelphia is one of the largest in the country. It makes perfect sense that we need a fund that's very large. Philadelphia is one of the most impoverished, if not the most impoverished large city in the country. And what we know about abortion is that its perfect axis is with racial and economic justice. So cost is a big barrier for folks. We have some kind of, we talk to a lot of different people, but there are some themes that have always been true since the beginning. Most people we talk to on the helpline are in their 20s or 30s. It's not as many teens as a lot of people expect. Last year, we talked to about 4,500 people. Almost 4,000 people used our funding to get care, and less than 400 of those were teens. So it's mostly adults. Most often, so everyone who gets an abortion typically they're more likely to be a parent, and that's definitely true on our helpline. Most people are parents of at least one child, and with an average income below $10,000 a year. We no longer collect income information, but that was true the entire length of the time that we collected that information. Most people we talk to are BIPOC. The majority of people we talk to are from Philly and Black. And things since the film have changed a bit, but not much has changed about folks calling us, just us as an organization. So we have our new name, Abortion Liberation Fund of Pennsylvania. We used to be Women's Medical Fund at the time of the filming of this. We also have changed the staffing structure on our helpline. One possible angle the filmmakers were looking at doing early on was following the counselors through their training. Like myself, you saw students there who were doing work study hours or volunteer hours from their university. And it was a beautiful way to incorporate young people into the organization. They would be enthusiastic, learn a ton, but they also moved on pretty quickly, as students do. So it was a lot of investment in learning. And we've recently shifted that investment into having just full-time staff answering the line who are able to get the practice in creating expertise in serving in direct service, and also to employ people who more closely share lived experience with people calling in. So that's been a really wonderful shift since this filming of the documentary. And I guess I would also like to add, whenever I think about this film and I'm getting to talk to people who might be seeing it for the first time, the calls are pretty well representative. They're not too cherry-picked. I will say the majority of calls on the helpline are folks who are not necessarily facing a fetal anomaly or domestic violence or something even more traumatic than just living in poverty. A lot of folks, this is a call on the list of things they got to do today. It'd be much easier if their insurance would cover it, but we're glad to just be a good soft landing place. So open to any questions at all. Alicia is also going to add some more in about crisis pregnancy centers or anti-abortion centers. I also see a couple of thoughtful questions here. Peggy asked about collaboration we do with other services that provide hotel, transportation, and food. Yes, so in abortion funding world, we call those needs practical support. And we often collaborate with other organizations locally and nationally who are helping out with that. Our budget is really focused on paying for the abortion care and then being the coordinator and the tether with the other organizations who are focused on that practical support. As you can imagine, since the reversal of Roe, we are seeing a ton of people from all over the country up here. And so we're really leaning especially on national organizations who are helping to pay for the flights and the transportation and just kind of being that connector there. The list, I would say the main providers of that nationally are going to be the National Abortion Federation and the Bridget Alliance are the two biggest. And then there's Apiary is a new kind of network of all of them that has kind of a network similar to the National Network of Abortion Funds, but all the practical support. So looking at Apiary would be a really good resource.
And Mara, we had another question in the chat and then some in the Q&A. But in the chat, we have on average per year, how many individuals do you have to say no to because you don't have enough funds to support the needs for abortion?
That is a difficult number to track down. For a long time, it was impossible because of our actual phone structure. It would be like the system would just be overwhelmed and didn't count everyone. Last year, we were able to pledge funding to almost 100, well, a good percentage. So about 4,500 people called in, and we were able to make a pledge, a promise of funding to about 4,100. Not everyone who gets funding from us goes ahead and uses their funding for reasons. Some of them include sometimes if you're early in pregnancy, it's not uncommon to miscarry. Sometimes someone might just decide differently and not pursue the appointment. Sometimes it's still not enough and people don't make it to the appointment because we often can't cover the entire need for each person. And the only fun one is that sometimes we just never got billed for it, but they got their care and who knows what happened.
And then we had a question in the Q&A. Is there an average start of the day dollar amount that you have?
Yeah, so we try very hard to parcel out the funding so we're never out of money at the beginning of a day. So it varies a ton, but and it also varies throughout the year. But I will say we're hoping to fund over like about $800,000 of abortion care this year. So if you want to try to divide that up into the days, you can. But I will say that's what we're planning to do this year. And it really just gets parceled out to try to make sure that we can do something for the community every day.
And in the chat, two people have sort of asked, what can people do to support abortion funds? And then right here is for folks who might want to collaborate with ALF to help gather funding or host an event. How should they go about that?
Yeah, I'll let Alicia speak more to it. When you have me on the microphone, I'm always going to say funding abortion, like you can really make the whole difference with $20. I talk to people that's what stands in between them and care. So donating is always going to be what I'll bring up first, but I'll let Alicia talk more about that.
And then one final question before we loop Alicia in. How can youth and college students support your work now that the shift has occurred to have the hotline staffed by full-time staff?
Well, a lot of it, like organizing campus events is a great way. So we have a couple opportunities throughout the year, but there's always an opportunity where young people could have their clubs host bake sales to raise funds. They could also, if they're local, we often will come do political education and come talk at the school or with them in clubs. There's also other ways that young people can get involved, especially like depending on where they're looking to do their work. There's reproductive justice student groups for lawyers, for future nurses. There's different groups like that. Medical Students for Choice is a great way to get into actually providing abortion care. And we tell everybody that you can always get involved in one of those ways.
Great, wonderful. And I'm just going to see if there's any last follow-up questions for Mara before we invite Alicia on. Okay, great. Thank you so much. And Alicia, if you want to take it away and talk about AACs.
Yes, I was off video and camera because I honestly was trying to protect y'all from seeing my face because there's been so many changes since this documentary came out. So I'm really happy that Mara had a chance to join us today and talk about some of the changes that have happened, within our fund, which of course we see as progress, of course. But I'm going to pivot a little bit to talk more specifically about anti-abortion centers. And I'm going to share my screen, but also just know that these slides are available. Jessica's going to send them out, so don't feel like you have to take copious notes. We also have the ability, if you would like to what Mara just stated, somebody to come and do a presentation specifically for your group or your friends or neighbors. We would be happy to make that arrangement. So let me do this screen share. Okay, actually. Okay, can we all see that?
Yep.
I am deliberately not having the full, I can't see you all. So if you have any questions or what have you, just pause and tell me to stop. Basically, just for definitions, because language is important. So we've been talking about this for a very long time. We, the collective, but also us at ALF-PA. And we've been saying crisis pregnancy centers, but we changed our language because a few years ago, our partners at Equity Forward, which is a national org, did a survey of folks and asked, do you know what a crisis pregnancy center is? And people said, yeah, sure, that's Planned Parenthood, right? So we said, no. So following data and following the recommendations from our friends at Equity Forward, we started using language that is more reflective of what's happening, which is why we say AACs. So these are unlicensed clinics, which you might still hear referred to as fake clinic or crisis pregnancy centers. Our goal here is to collectively help shift the narrative around how people see these centers. So please, moving forward, use AACs. These are almost always faith-based anti-abortion organizations that use all of our tax dollars. So if you pay taxes, you are funding these. And they use manipulative, deceptive, and lies to basically convince pregnant people and dissuade them out of having an abortion. I want to make no qualms about the fact that anti-abortion centers are absolutely designed to impact and harm Black and non-Black birthing people. Like, this is unmistakable across the country, specifically Philadelphia, PA. This is known to be true. It's a specific tactic that our friends at Real Alternatives are using. They use free resources, and I'll get to that in a second, but they promise free resources to literally lure people into their facility. And then they basically hold them hostage. And I don't mean this dramatically. They literally are telling people, you are unable to leave, you're unable to get these diapers unless you stay with us for X amount of minutes. And they also use a lot of money to put out propaganda, basically. And we're seeing this pop up even more so now in media post-Dobbs, where for various reasons, probably sensationalism and money, the media is choosing to give space to these crisis pregnancy centers and anti-abortionists whose only agenda is perpetuating white supremacy. So I just wanted to give a map. So just for a disclaimer, this is before Dobbs. We know or believe that these have, what's the word? Like they've grown since COVID significantly, and they've grown even more in a post-Dobbs era because white supremacy, because the anti-abortionists are relentless in figuring out ways to basically disenfranchise and disempower our communities. So this is just a snapshot map of where they exist in Philadelphia. This is what they look like in PA. So all of these little maroon, dots are where they are in PA in comparison to the yellow dots, which are, or I guess those aren't dots, but whatever they are, compared to the actual clinics, right? And so it's not just happening in urban areas, if you will. This is happening statewide. It's happening across the country, but Philadelphia and Pennsylvania were the birthplace of these facilities. Hold on. Oh, this is what I was saying earlier. So they are horrible, horrible human beings. I have no qualms in saying that. Light emphasis on the human, but they literally keep people in and offer store credit if they participate in these classes. And these classes are really designed from a heteronormative, patriarchal, white supremacist understanding about who's allowed to be a parent, around who's allowed to have agency over their body, and who's allowed to have an abortion, right? And so we know, because of the connection in our country with regulating and controlling Black, brown, and Indigenous bodies and other marginalized bodies, that this is designed specifically to perpetuate white supremacy, right? And to continue to cause harm to Black and brown birthing bodies. People always ask this, but we don't know how it's legal, y'all. It just is. I just like to point this out because we get this question a lot in the word choice. And we, as much as possible, try to say this over and over and over, that what we do at Abortion Liberation Fund of PA, including any effort to try to shift the anti-abortion centers power, is not about choice, and it's not about legality. This is really a matter of freedom, and this is a matter of social justice. Blah. I told you it's very long, y'all. This is the part that everybody wants to know, like, what do we do? What do we do? And we absolutely want and need everybody to be as angry and motivated as we are, to not necessarily fight the beast, because the beast is huge. The beast is the Catholic social services. The beast is the Catholic Church. The beast are elected officials, not even R's or D's. I'm talking elected officials widely, who are in cahoots with the Catholic religion social agenda. What you can do, though, is be proactive, right? We don't always have to fight with fists. We don't always have to fight at the state legislature. What we could actually do is show up for our people. And how we do that is by doing what Mara said earlier: donate. Donate to us if you are here in PA, donate to your local fund if you are outside of PA, and ask everybody you know to donate locally. It makes a huge impact. I can't understate this or overstate this enough. But supporting locally actually is the quickest way to get money into communities. And at Abortion Liberation Fund, we also have a community care hub in which we are distributing diapers, emergency contraception, pregnancy tests, menstrual products, etc., to communities where communities live and where communities frequent. So donate so that we can continue to do that. Stay informed. The quickest way to know what's going on at our work and within abortion funding is to follow us on social media. Our website is okay, but it's not the quickest. Really, it's Instagram, I would say, is our go-to, and then maybe Facebook, maybe Twitter. But follow us. We also do our best to try to uplift other efforts that are happening in the city, so you can stay informed about all of the ways in which abortion is absolutely connected to housing, to police abolition, to the prison industrial complex, et cetera, et cetera. And then I already said about your PA friends, we don't want you to, we please ask you to don't start an auntie network. We saw this populating around the time of COVID, where folks, time of COVID / jobs, where people were like differently aware that this was an issue and wanted to do something. And like I said, we don't want to not have people do something, but don't cause harm because you have this excitement to help. Like, do your research and then resource the existing networks, of which there are plenty. Mara already stated, Bridget Alliance, Apiary, and then locally here, you can get connected to folks who are doing that work here. Please refrain from using racist language, always. Don't use Underground Railroad, for example. Don't remain still. This is not the time to fall back, right? Unless falling back is required for your own rest and mental well-being, obviously. But there is the ability to take action in lots of different ways. These are just some of them. That's basically it. I'm going to stop screen sharing now so I can see everybody's faces.
So we do have a question in the chat: is what will the role of medical abortions be going forward? Mifepristone, probably butchering that, but.
No, you got it. Mara, you want to take this one away?
Sure. So medication abortions are especially becoming more popular since the loss of Roe in states where people are able to get them mailed from providers, sometimes international providers who are like Aid Access, who are working with US citizens, Plan C pills, and others. So especially in states that are hostile to abortion or where abortion is illegal, that's one way that people have been more covertly able to access care in their home states. It's also always been a method that allows people some flexibility too, if they're having an abortion around someone who needs not to know. And it's better off that it seems like any old period. In Pennsylvania, there has not been a shift in the role. The role still is that it's one way that people have abortions. We're always going to need medication abortions and surgical abortions. Not everyone will prefer to have medication. Not everyone can have one and will require a surgical abortion, but it really depends on where you live. It's been revolutionary, and it's also not going to save the day either, especially with needing to get with the level of surveillance on people in those most hostile states, where getting that mail is a risk that they're taking.
Yeah, and I also just want to state, thank you, Bara. I also just want to state that LFPA is part of a citywide coalition, a newly emerging, I should say, citywide coalition that is really intending to be proactive in getting information out about not only abortion restrictions and how to access them legally, how to access funding, but also the various ways in which abortions can take place, including medication abortion. And so I don't have necessarily the way to follow that along just quite yet, other than following along with us for right now. It literally is like a work in progress, but it's exciting. It's exciting to see the city like stepping up in ways by way of resourcing via funding, via information, and via collective information gathering and information distribution. So yeah, it feels like an exciting time to be in Philly. Go Birds.
I see another question here in the chat. How much do the medications cost and how are they prescribed?
Right now in Pennsylvania, they are the same price of a surgical abortion at the same time in pregnancy. So that averages about $400 to $500. That's the case. My understanding is that is the case because it still requires, state law in Pennsylvania requires that it's a physician talking to you about the pill and literally handing it to you. And doctors are expensive. So all the infrastructure around, the person still has to physically come there, sit with a doctor, share time with them. And also, I'm sure pharma has the price up as well. So if you're going through a clinic in Pennsylvania, it's the same as having a surgical abortion the first trimester. And they're prescribed only by doctors, not like nurse practitioners or anyone else. There has been a change nationally in mifepristone's prescription. My understanding is there's already been a challenge to that. There has been no material change yet on the ground to see how that change in like FDA stuff could change things. From my understanding, day to day, we don't see that effect yet. But the dream is that even pharmacists could prescribe this, and work through your pharmacy. And that sounds a lot cheaper than involving a doctor. But to date, the cost hasn't changed.
I also just want to remind folks, because I feel like sometimes we forget this part, but abortions have happened as long as people have been around, right? Like people have sex and sometimes people get pregnant and sometimes they don't want to be or can't be, right? And shouldn't have to be. And abortions happen in community. Abortions happen by midwives, birth workers, other healers, right? Using traditional medicines. And our logo actually depicts some of that herb, right? Those herbs, those sort of roots, if you will, as a reminder and as paying homage to the fact that the abortion that's taking place in medical facilities is a relatively new concept that's absolutely driven by capitalism and paternalism and white supremacy. So the dream is that abortion is free and abortion happens in communities and abortion happens for whomever needs it for whatever reason using any method, right? So if folks can also start thinking about that, because I know that it causes significant agita in folks when we start talking about things happening outside of a clinic and it being unsafe. But that's a very antiquated idea, with the exception of what Mara stated, which is that we already know the connection between abortion restrictions and surveillance in this country, specifically for folks who are already surveilled by the state. So we don't want to make it seem as though it's easy peasy for folks who are already differently impacted by state violence.
And it looks like we have a couple questions in the Q&A. Have you seen fewer providers willing to do abortions? Is there a shortage of providers who do abortions?
Sorry. Certainly after Roe has fallen, there's whole states with no providers at all. The clinics have to shutter. In Pennsylvania, we haven't seen less providers. Luckily, it's very difficult to open new clinics, though. It's because our people who provide abortions are under physical threat at all times. It's also always been difficult to make sure that there's a steady flow of providers coming in as well. We've seen a few new providers start, luckily, in our general region, which has been beautiful. It just still is nowhere near meeting the need of everyone flying and driving over here. So up here, haven't seen providers closing, but definitely have been experiencing daily that we're kind of busting at the seams, trying to serve everyone who's having to seek care elsewhere.
I also just want to lift up that in response to the Roe decision that we all knew was happening, we created a toolkit, which is also on our website. And by we, I mean the organizing crew at ELF PA. So shout out to Solange and Penelope P. So that toolkit, basically, if folks can, the other thing folks can do is to get that into the hands of literally everybody, because somebody you know either has or might need an abortion, right? And so that toolkit basically states, how do you know your options, know your enemies, and know your power? And so that toolkit is specifically designed with abortion seekers in mind. The number one thing that we're hearing, even just as recently as yesterday with that city coalition call, is that by and large, folks are not clear about what is legal in Pennsylvania. And so even though we've done what we can as a fund to try to get the word out, even though our partner organization, New Voices, put up billboards, I think like the day that it broke, they had billboards up already, maybe even before, saying abortion is legal, you know, in PA. We also know anecdotally, though, that folks are actually, I don't know if I have permission to necessarily share the story, but I'll just state that people are being told abortion is not legal right now. So in our state. So that's very anecdotally, like we don't have a way, because as you could imagine, we are literally overwhelmed and completely underwater in the abortion world to keep track of just like getting abortion funding out there. So there's not, as far as I know, anybody who's actively tracking the ways in which different independent providers or doctors in like an OB-GYN clinic, right, of which there are plenty, like, what are they saying to people? Like, it's hard to say that unless somebody reaches out to us saying, like, is this right? You know, and that takes a great amount of agency, because so many people take whatever the physician says as the gospel truth, you know? Well, if the doctor says it, it must be true. So we have our work cut out for us. And so this is also why we're so grateful for Women's Way, who always comes through in elevating this issue and getting the word out as wide and far as possible.
Thank you for that. We do have one last question. I think it sort of touches on that toolkit you were referencing, but what resources do you recommend to help folks talk about reproductive justice and abortion liberation?
I'll start, and then Mara, do you want to take it over? So definitely the toolkit. And then the other thing that we've been trying to do, which is why we are really excited about our name change and our logo, is that we, meaning we, the people who are on the side of justice and liberation, the collective, we have our work cut out for us, because people are still like speaking in whispers around abortion. Abortion is not a bad word. Abortion is an act of love, and we need to shift the culture around saying that out loud, right? So be very abortion forward. There are, I don't have the link, but I'm sure I can find it. If you want to start a conversation with your family, with your boo, with your colleagues, there's conversation starters that are called a heart-to-heart toolkit by the National Network of Abortion Funds. And these literally are just like cards that you would have laying around your table, right? And it just asks questions to get the conversation started. So you don't have to even reinvent the wheel. You don't have to say like, oh, tell me about the first time you ever had an abortion, right? Like you can just use this toolkit, right? So that's a resource that I would highly recommend too. But Mara, what would you say?
Those are great. I think to get more steeped in understanding the ways that abortion access sits amongst a wider lens of reproductive justice, and I would say get read up with works by Dorothy Roberts, a local expert who you can really learn a lot from to kind of situate how all these things, pieces that Alicia has talked about today, are all connected. Sister Song, Women of Color organizations, also great to kind of understand the history of reproductive justice and learn more there. And then just, yeah, to underscore, like we've said, try to pay attention as locally as possible. So wherever you go, there's going to be an abortion fund there, and you'll see who they're connected to. It's us in Philly and most of Pennsylvania. And staying in touch there rather than sometimes the loudest voices, the most well-branded voices might be less in touch with what's going on the ground.
Thank you both. I'm going to pause to see if there's any last questions, but in the meantime, we are going to throw a survey in the chat. We love to get your feedback on these sessions that we do. So that's very much appreciated. And Andrea, I see post in the chat those authors and readings. We're going to be sending out an email following this event within the next half hour or so, again, hitting you with that survey. And then, of course, a list of resources provided by Mara and Alicia. And any final questions before we wrap for today? Oh, let's see. We do have a final question. Do you think that those of us who have had an abortion ourselves should be increasingly telling our stories to normalize?
Yes, I think so. It's also your story too, and you get to decide when it feels good and okay for you to share. So I like personal is political, like very much so. And then also you get to guard your energy too, because there's some folks who don't deserve your story because they're not gonna hold how sacred it is. But if you're up for it, one of the most powerful and moving things is for someone to know that they love someone or know someone who's had an abortion. It's also a very
you mean this?
Yeah, here you go. Everyone loves someone who's had an abortion. Also, studies show us that one of the most moving things is stories of people supporting others who have had abortions too. So even if you obviously respect confidentiality of a friend, but even telling someone, I've driven a friend to an abortion, like that's very normalizing and can be really transformative for people too.
Even when I just started working at ALF, like 5.5 years ago, people were coming out of the woodwork. People I'd known for 20 years saying that they had an abortion, so had I known that all I needed to do was, say abortion out loud, I would have done so earlier. So that's why I say, like, I was literally born in repro. I think I've been in repro longer than some staff have been alive, but yeah, so just saying it out loud, right? And just like really reclaiming that word, because the antis, I guarantee, are teaching their kids from the time that they are in utero about abortion and how, all of the things that they do, which to my, whatever, child abuse. But anyway, yeah, talk about it.
Great. Well, thank you both so much for joining us today. We heart our friends over at ALF. And glad that we could do this together. We will once again be sending out an email with a list of resources and the survey, wink, wink, take the survey. But thank you, Alicia and Mara, for joining us. And we'll get that email out to you all shortly.
Thank you.
Thanks, everyone.
Bye.